Another story out today. This is a report done by a regular on this program, Pradeep Phillip, and it's on the Medicare system, wastage, claims of rorts. Where does that all stand?
Well, we had these reports last year in the 9 newspapers that more than $7 or $8 billion was being lost in Medicare fraud. Based on the claims of a Dr. Margaret Foe, the government sent this off for review and have come back with a figure between $1.5 billion and $3 billion a year, so substantially down on those reports. But it's not just fraud, but what they call non-compliance. Now, consultant Pradeep Phillip's report found this. He said, "It's not possible for me, based on the lack of available data in the system and the time frame for this review, to conduct and provide you with definitive analysis of the extent of non-compliance and fraud in the system. This analysis provides an albeit partial perspective that leads me to conclude that on a conservative definition of non-compliance and fraud, it is entirely feasible the value of non-compliance could exist in the range of $1.5 billion to $3 billion, not inconsistent with previous studies. This comes with a significant caveat in that there is real potential for the problem to scale to the order of magnitude in Dr. Foe's analysis, should effective controls, systems and education not be put in place." So the wood's on the government to act. The Shadow Health Minister Anne Ruston has said today that the previous government put in measures aimed at recouping $2 billion in non-compliance a year already. It is unclear at this point what the government will budget for in terms of savings in the budget from adopting the recommendations of Dr. Phillip. And we know that the Australian government, after some delay, Kieran, on a separate matter, has followed the move of allies and finally moved to ban TikTok from government devices today. No talk of a wider ban at this stage.